Okay, welcome everyone. I think I misjudged the time. We were supposed to start at 2:15. I think I heard it was 2:30 when we left, so I apologize for that. We lost maybe a few minutes, but we'll try to figure out if we can keep the time like that. So I introduce myself. I'm Raman Preet. I am based at Umeå University, Sweden. And here I also have I'm representing the climate health cluster that you all heard about, which is a 6 Horizon Euro project that EU has funded. And myself, I am a dentist, dental public health, working with coordination of European Union projects for more than a decade. And I think that's many people have very profoundly said they are not researchers, so somehow I also don't think I rather manage research. And I also call myself a global health optimist, a boundary spanner, and a generalist. So in that role, with 25 years of working experience in different parts of the world, and having heard so much in a space called climate change and health, and for me, I think I was one of the first public health professionals in United Nations when we were just thinking of putting climate change on the map. So with that, I feel very kind of calm, happy to have so many of you here, to be able to share with how we've done the things over the years, but also to see maybe the agenda or the theme that we are going to discuss now is global research, a health agenda on climate change and health. That's the 4th theme. And somehow we are the last numbered parallel session, number 12, though we are running parallel, 10, 11, and 12. So, and our title, what we are going to talk is models, tools, and technologies supporting decision-making on climate change and health. And I think some of these things from which the cluster we are is also doing, but we will hear from our other colleagues as well. Together with me, I have a very strong panel. We've been communicating on different issues, but also personal issues when things don't reach and how some things can delay. But here we are, and we hope we are able to keep you all engaged in the next 1 hour that we would be working on together. Before I invite our first speaker, I would like to say, to set the scene for today, for the next few minutes, I would like to share something that we tweeted at the launch of the cluster from the project that I represent, ID Alert. And probably, yes, they are my words, but I do want to share them with you all. The launch of Climate Change and Health Cluster earmarks the recognition of human health in climate change discourse. Not much can be achieved if the focus does not advance a people-centered approach. This equally applies to the processes where we are talking about co-design, co-creation, and co-thinking. However, we need to work on co-implementation. Hence, a great thread from our previous session in this room, where we were thinking about implementation science. So I invite our first speaker here, Professor Rachel Lowe. She's a ICRIA research professor and Global Health Resilience Group leader at the Barcelona Supercomputing Center. And also, she's the director of Lancet Countdown in Europe, and where it's a transdisciplinary collaboration tracking progress in health and climate change. You've all heard about Lancet quite a lot, so I do not need to say more. Rachel, please. Thank you.
Thank you very much, Raman. It's a pleasure to be here with you all. I'm going to share some research that we've been doing on developing indicators for early warning of climate-sensitive infectious diseases. So many of you are familiar with the Lancet Countdown, which is a collaboration tracking the impacts of climate change and health across many different domains, from impacts, adaptation, mitigation and co-benefits, economics and finance, and political engagement. So we've been working on the global collaboration for several years now, and just under 3 years ago we launched the Lancet Countdown in Europe, where we are focusing on developing the indicators for stakeholders specifically in Europe. Here on the slide, we can see the report that we published from the Global Lancet Countdown in 2023. The Nature magazine wrote a news article focusing in on some of those indicators, in particular on the indicator tracking changes in climate suitability for malaria. And we can see here in this map the areas of the globe that since the 1950s have become newly suitable for the transmission of both of the malaria parasites. So these kind of indicators can help us identify areas of the globe where we really need to focus and adapt our measures to try and prevent the emergence of spread, for example, of these infectious diseases. And the way we do this is we use global products, for example, the reanalysis ERA 5 land product. So these are products that can tell us about hourly changes in a range of different meteorological variables, for example, at a 9-kilometer spatial resolution. So we can produce these so-called maps without gaps to help us track the changing climate suitability. So here we can see layers of temperature, precipitation. For the malaria indicator, we also consider how the climatic environment is changing across altitudinal gradients, and this allows us to identify the particularly fast increasing suitability in the highlands. And for many of our other indicators, we're assessing these changes in a hazard vulnerability exposure framework, and where we can, we try to account for different population exposure and different vulnerability groups in terms of age, income, gender, and this can help us try and track these changes according to different vulnerability groups. But of course, these large-scale indicators are limited to areas where you actually have ground truth information about what's happening, particularly in terms of meteorological changes. And to make them useful on the ground, we really need to be engaging with local stakeholders and local communities. In the Global Health Resilience Group that I'm leading from the Barcelona Supercomputing Center, we're working across a range of different projects with partners across the globe. We have funding from the Wellcome Trust and Horizon Europe, and we're working to develop decision support systems, particularly early warning systems for predicting the probability of outbreaks of diseases like dengue. You may have seen upstairs, we have a poster led by Chloe Fletcher explaining an early warning system that we're developing to track how the current El Nino has been influencing the probability of outbreaks in hotspots in Latin America. We also are working on taking a step back and developing robust digital tools to help gather multi-source data sets and combine them with ground truth data that we're collecting from drones and weather stations, so we can try and provide locally relevant information to try and track these very sort of fine-scale changes. And we're developing our tools to try and help users be able to combine different climatic indicators to predict the probability of outbreaks. And with that, I will pass over to the next speaker. Thank you.
Thank you, Rachel. And I think we think of malaria, which is quite spread around Africa, and we generally think about that. And the way you finished it towards dengue, I think there was time maybe a decade ago when we could not imagine dengue in Europe. But it's coming home in one sense, if may I say. And that brings the importance of some of the global products that we think we are tailoring towards health, and more relevant for us to have more timely information that it goes. With that, I would like to invite you, Matthew. Yeah, and Matthew he's a research professor working at Minx University in South Africa, and he's worked on several EU projects that we understand with Wellcome Trust, and many more that have examined the heat exposure on maternal and child health. So please, Matthew.
Excellent, thanks. So my back is to some of you, apologies. Maybe I should switch halfway. Speaking of switching, can someone switch slide on? Oh, right, I see. Okay, marvelous. Thanks, everyone. So I'm going to briefly talk about attribution. So I think a lot of people are familiar with how we attribute hazards. So when there's a flood or a drought, we've got the math to figure out that this was most likely due to climate change as opposed to natural variation in climate. But within the health space, the impacts of health, we currently, the top bar, we would say something like heat. There were 60,000 deaths among people above 65 from heat exposure. And that heat exposure, those deaths are attributable both to natural variation in temperature, there's always been heat waves, and there's some beautiful historical descriptions of heat waves from thousands of years ago. But so that's a mixture of those two. So as a scientist, that's a little bit dissatisfying. And when you do impact attribution, you now split these into those two clearly discrete areas. And that's the second chart there. So I think that good science is important. And as we open the door of that science, we'll see these new pathways and applications, how this might be used. The first one is good science generally leads to good money. And this is how impact attribution started. It was around litigation. So you want to take BP to court and you say, look, you're responsible for 2.5% of global emissions. You should be paying for 2.5% of the costs, or at least 2.5% of your profits going forward, or whatever. So litigation was where it really started. And the other money is around loss and damages. So if you are able to say that there were 10,000 additional preterm births in Africa from climate change, okay, so not from heat, from heat attributable to climate change, we know the cost of a preterm birth, and now you've costed the loss and damage, or you've costed the health impacts of climate change. The third area is you can now begin to cost, stake was the word we used the other day, or you can begin to cost the emissions, the direct health impacts of emissions. So that's the bottom bar. So here, in other words, you'd be able to say, if we were to have this mitigation program, or to switch to this level of, the solar in one area, how many preterm births are we going to avoid, or how many deaths in elderly? You're now making this beautiful, good science way of linking really what we need to do when we say practically bringing mitigation together. And the second area I think we should raise is around communicability. I do a lot of talking, for better or worse, but I do a lot of talking, and I always struggle to communicate this. And people don't understand when I say hot weather causes X. If I'm able to say climate change causes X, you're able to really communicate in a much better way. And the last area that I really think, in my view, is really important is around indicators. So we're able to really be able to use, ideally, actual human health outcome data to measure the health impacts of climate change within, not real time, but annually, for example. So using the DHIS2 data, for example, if you had that and you had your mathematical models functioning, there is some complexity. But if you had your code in place and you had all the climate data, everything, the data platforms in place, every year you would keep pushing in this actual health data and be able to give real-time information. And that's important for a district. So they know where to target their finances. It's important for a country. Because now, hey, health is causing a lot of burden of disease, which costs X. And it's important at international level around advocacy. So with the health sector, we say it must stand up, but we also need a platform to be able to stand on. And in health, a lot of those platforms, those who are familiar with HIV, but most conditions are built on numbers that you then are able to make an argument to look. Sadly, one would say my disease is more important than yours, but hopefully not that crass. But at least you're able to begin to raise our kind of profile. Should I stop, or we've got another minute? Stop, okay. When was it?
So yeah, that's a little abrupt, but for sure.
Okay.
Time, so
sure.
Thank you so much. I think we will return to, because you're raising some of the, maybe the last panel where we discussed human data and, let's say, meteorological data.
Thanks.
And probably we move on from there, and we bring you in, where Julie, and Julie is the leading one of the, leading the Copernicus thematic hubs at the Copernicus Health Hub, and which is a new tool that helps the health sector for better leverage on all Earth observation data, right? So she's doing some of the things maybe we are very curious to hear, and how it all links up to the questions that we have. So here, Julie, floor is yours.
Thank you very much. So I will present a little bit what we are doing. So I'm a part of ECMWF, in short, the European Weather Forecast Center. So we, as a center, produce since more than 50 years now the weather for the Europe, but also at global scale. And because of that, several years ago now, the European Commission mandated us to host some of part of a Copernicus program. So the Copernicus program is a program, European program that is in charge of the Earth observation. So using a lot of satellite mission produced by ESA and EUMETSAT, but also having some in-situ measurement. When we have all these measurements, we have decomposed it in 6 different services. So, of course, it's the climate change service, but we also have the atmospheric service. Both services are hosted by ECMWF. But we have more than that. We have also the land, we have the ocean, security, and emergency services. All these services are producing different parameters, different indicators, different products that are relevant for the Earth observation. Some of that products are relevant for the health sector. And it's what we try to develop with the Copernicus Health Hub. So we've decided to try to map all the products that we have in-house in Copernicus, but not only, we kind of also try to integrate ECMWF or other projects like Destination Earth products that are relevant for the Earth observation, and we try to see how they are relevant for the health sector. Because we are not health professionals, we get the support first of our stakeholders, but mainly of our advisory board, and I see several of my advisory board members around this table. But we also have the support of the KCO with DG DEFIS and GRC. So what we're doing, and that can be useful for the community, is we have collecting mostly, we are not a research center, we don't produce research, but we collect all the research development. We collect as what we call user story or use cases, and we try to put them in as a showcase on the hub to see how our data can be useful for the health community. We also have what we call a catalog of data that have been useful for the health community. So we are not health professionals, I repeat. We just try to provide environmental information for the health sector. And I will stop there.
Thank you, Julie. Thank you very much. So here we've heard that, again, I'm not a researcher, but we are collecting data that feeds into lots of things we are doing. So I think in the end, we will also maybe ask ourselves like how these things need to move on. With that, I would like to invite you, Jan. So Jan Minx, he is the head of Applied Sustainability Science Working Group at the Mercator Research Institute on Global Commons and Climate Change. And he's been coordinating and the lead author of the 6th assessment report of the Intergovernmental Panel on Climate Change, IPCC. And he's done the same previously, coordinated the 5th one. And he regularly contributes to Lancet Countdown, so you're sitting together there. Probably we'd like to hear more from you, Jan, your contributions to this.
Yes, thank you. And I want to start where Andy Haynes kind of stopped, basically with the need for rigorous evaluation. We should never forget we only have 3 decades left to not only stop global greenhouse gas emissions growing, but bring them back to zero. We've taken more than 200 years to grow them, and we have 3 decades to get them down. So basically, we need rigorous evaluations of what works and how does this help to protect our health. So therefore, I would say we need to start the age of climate solutions and act swiftly based on the best available evidence that we have. And so understanding what works, under what conditions and why is absolutely critical. We need evaluations in the climate and health space. We usually cannot rely on primary evidence only if we do research, and this is just an example because we want to avoid that we, are taking just one of these guys that I indicate there. So we need to not only do evaluations, but we also need to invest in rigorous evidence synthesis, and we have the methods for this. And I would claim we not only have, we've talked a lot about gaps, but I think another gap that we have already today is an evidence synthesis gap, and we need to fill that. This is one of the fundamental challenges that I think we need to address as a community. How can we do this? I think it's definitely tricky. We have seen this map. We've developed a lot of times, but it has always been used to identify the gaps in the evidence. What I want to point out is that there is a vast amount of evidence. We have tens of thousands of publications already today on climate and health. The literature is vast and growing exponentially. And this is both, I would say, an opportunity, but it's also a threat and an opportunity. And I think advances in AI, in artificial intelligence, are here key to actually turn this into an opportunity, because we need to radically reduce the amount of work that we do for actually reviewing literature. And I think AI can help doing this. In this kind of mapping exercise, I think we are already there pretty much and can fairly automate the production of those maps that they are almost in real time get updated. So we can then use them to basically show what the themes of research are, where the research is geographically, and this kind of automated system is already today the basic of the Landsat countdown indicator on this. I think the situation is a little bit different when we think about systematic reviews. There we are not thinking about computer assistance, but more about, not about automation, but computer assistance. So we need to radically reduce the efforts required by each task. And we have already gone a big way in terms of cutting down work in the screening and selection of literature. The big frontier is now text extraction. And there, large language models now provide a real hope that they can do a job almost as good as we do, but the challenge is to evaluate this, and in a Wellcome Trust-funded project called Digital Evidence Synthesis, we are just, starting to do that. Last point is living evidence. We've also talked a lot about the science policy interface, and I think the fundamental, one of the fundamental challenges is that the rigorous evidence is not available when decision may actually need it. And I think COVID was really nice because the community came together and tried to more or less develop this in real time. And I think the logic is really striking. Rather than doing reviews over and over again, we always start from scratch. Why don't we simply update it? So we once, push down the rock to the hill, and then we just keep it up there, keep it up to date. So I would say it's much more research, it's much more resource efficient, and we can do we can save a lot of resources and have still gold standard evidence. This requires a lot of rethinking of how we do research, how we fund research, and how we publish it. And much of the groundwork is currently conducted by the Alliance for Living Evidence, ALIVE, that you are seeing there. It's definitely worthwhile. During COVID-19, they actually managed to reduce the amount of time that it requires from a paper to get into a guideline by 99%. So I think that's a striking potential. Also here, there's a lot of potential for AI to make this process much more efficient and less resource intensive. So above all, maintaining reviews provides growing numbers of extracted data that we can then again use for learning. So I think there's a very strong logic to this. Supporting the field of AI and evidence synthesis as well as living evidence could help us to produce a rigorous evidence base on climate and health that could timely inform urgently needed policies to protect the health of people and planet. Thank you.
you work with so many of these different reports and things that you are creating at your end. So what would you like to add?
Yeah, I think in general there's a big gap between what researchers think is useful for policy and what actually is needed for policy, because we don't have those sort of those co-creation spaces to really build the strong partnerships. I think part of this could be solved by funders working, sort of bridging that gap between the two and developing calls that really do respond to a specific policy need, and then putting out a call for researchers to really address that and ensure that the research can feed into policy. So I think there's often a perception that researchers build up their tools and their models and wait for it to be near perfect before they share it with a potential user or decision maker, but really it has to be, you know, from the outset of a project, having a real sort of co-production process to ensure, you know, each different partner in these collaborations is aware of what are the challenges, what problems do we need to address, what data is available to address these problems, where are the data gaps, how can we improve our data collection processes to make sure that we can have the best evidence available. So I think really we need to be moving more towards these like true co-creation processes, but the researchers need funding support and guidance about how to effectively integrate and interact with the policymakers.
Can I ask, like, I know you are involved in, can you give any example on where you think in the co-creation processes that you've been involved with, something that you've done that we can learn from, something from the beginning stage?
Yeah, we've had a very successful co-creation process with our partners in the Caribbean. So for around, I think, 6 or 7 years now, we've been working with the Caribbean Institute for Meteorology and Hydrology and the Caribbean Public Health Agency and researchers from different institutions and local ministries of health as well and meteorological services. And it's really been trying to develop decision support tools, particularly in the form of early warning systems for dengue and other climate-sensitive diseases, to respond to a real need to want to be able to prepare and allocate resources in advance, particularly with the changing epidemiology we're seeing with climate change. We're seeing more droughts, which is changing the timing of outbreaks. We're seeing storms and different climate-sensitive outcomes. And that has been a very successful collaboration because it's allowed us to, we've had these co-creation spaces. We've been in the room with the Ministry of Health and Wellness, with the meteorological services, seeing everyone exchange knowledge, align their vocabulary, and really sort of learn from the different fields about how you can integrate the way you prepare for meteorological hazards, how that can be applied to epidemiology. And so that's probably been one of the best examples where there's been buy-in from all the key partners and stakeholders in the area.
Thank you. I think it gels very well with the previous panel that we've had. We were talking about contextual solutions and, you know, how we need to move on. So.
Yeah, I can just mention that the implementation paper that Gina shared with us in the previous panel, that included one of our case studies from Barbados.
Oh, that's. From there, I would like to move to you, Matthew, because that's how we were, okay. So attribution research, we talked about that it quantifies the impact, right, of climate change and on health. So as opposed to just heat on health, like what would be an example, like as it is becoming topical? Do you think the attribution research can live up to its expectations, like how to try to design?
Right.
Yeah.
Okay, thanks. So it struck me and Young, we only just met, but we speak a very similar language in that we talk about the number of applications when you open up we have rich data and you're asking the right questions. So there probably are about 10 potential applications of real solid attribution evidence. A sentence like there were X number of deaths from climate change, could be heat, infectious disease, whatever source. There were X number of deaths from climate change in province Y. The number of applications, how that might be used, is really powerful. So if you have 10 potential and only 5 of them end up being useful, that's pretty helpful. So we don't know yet. So this hypothesis, because there's only around 14 studies that have broken this frontier. So we're not sure yet, but I'm very optimistic that this could kind of move us towards where climate change wants to be. I'm digressing, but a lot of the things at the moment I've heard the last few days is talking about the next steps, but not really what is the final destination. of what do we actually want this field to be. But attribution, I think, really moves us to where we need to be, not where we are slowly progressing.
So my following question would be, with these climate change and health programs, and they are kind of just beginning in many countries, as we've already talked about. Sorry. Climate change and health programs are just beginning to develop in many countries where we need to set up some of these monitoring systems, right? So in that, how do you think the research could inform, like as you said, selections? Do we have that process? Do we know which kind of indicators would be helpful in the development of these systems?
Gosh, I'm getting all the difficult ones. So, there are a lot of indicators already in place, and the Lancet is almost 10 years old. But, I think many of those are first-generational indicators. Because of data, difficulties with data, you're landing up with using a lot of modeling, and some exposure response curves are generalized to multiple areas where they probably don't hold true. So I think as we get more richer actual health data and systems in place where you share, and Jan has got a team of people trying to understand all these things, then we can take it to what I'm calling a second-generation indicator.
So he got a difficult one, so we hope we get something that comes to where we can take it to the next level. So I come to you, because you are leading one of the world centers on global weather forecasting. Can you share with us, throughout, what are your thoughts on the gaps of research and the linkages between, discussed mental health or environmental samples? How do you relate to those extreme conditions at your level?
So thank you. So actually, it's a good thing to talk about. So we kind of see different fields in the health sector linked to climate or to health to environmental data. But what I find the most challenging is people are coming on our website, and we have the data coming out of that, and the people are looking for mental health, the link between mental health and climate change, because it's a subject is so little study and actually kind of really important. So mental health is driving with really physically kind of issue, like when you are having some air pollution, you can have Alzheimer, you can have this kind of disease that are kind of physically implied by the quality of the air you're breathing. But you also have all these young people that are suffering a lot of depression and other kind of mental illness linked to the climate change and the impact it has on their everyday life. So that is a subject that is not studied quite enough, and I think it will be important to have more studies in that field.
And thank you very much for that, Julie. But I have a very interesting and maybe important question that hasn't come up in our discussions in the past 2 days, so allow me to ask you. In your opinion, there are lots of indices that you offer and the weights work, but what would it be like, mapping of a disease in a pathological way? Has that been discussed in the environmental link or the development of a disease? Do you come across that?
Yeah, so actually it was a discussion I had a few years ago with someone. It was a pathologist, and he was like, yeah, he discovered that actually one day one of the diseases he was studying was kind of a newborn, a lot of newborn in east part of Germany. They were born with a disease, but at certain period of the year, and they were really not understanding what it was. At one point they discovered that it was a transport of some spores from China. And nobody realized until they were able to put all the maps together. And it's something that we don't do enough, putting the environmental maps with all different parameters and just overlapping with maps of disease and the development of disease. And it's true that we're always looking at infectious disease or different type of health impact, but not enough we're doing with pathology. So it's something we should foresee, just make that in parallel, putting the map on top of each other and see how they match.
Lovely, because when we have the maps, maybe we will need to rethink the research that, Jan, you've made a case for, like how. So I want to ask you a question where, you've made a case where AI can offer solutions, less resource intensive. How do you think, and what timeline do you think would it be that they can go through some rigorous evaluations before they can be made available? So what's your take on that?
I mean, first of all, as I said, for mapping, I think we are already pretty much there. So I think we don't need to spend too many resources to track evidence over time. And I think there, obviously, as a community, we need to do certain things. Like, it would be nice, like in the health scientists, they have their RCT classifier so that they immediately, all the RCTs are classified at any time. I think we need to have something similar for evaluations and also certain types of modeling studies, you know, built. But these are really details and technicalities. So I think in principle the technology is there. For systematic reviews it's different because I think that's also, it's a very, very interesting question. What is a good division of labor between humans and machines? So if we want to basically maintain our quality standards in systematic reviews, you know, what can we actually do? And I think in terms of the tools you were asking for, when have we evaluated them? I think the problem is that there are already many tools on the market and they are not evaluated. So people are already using them and we don't know how good they work. I mean, right now, as I said, most of the stuff is on what they call prioritized screening, so that you screen more of the studies you know that are relevant, that you see them earlier and then they stop and at some point. And yeah, there are lots of technologies available where I would say they are not really tested. But the more interesting thing is, you know, where we really lose time is when we extract data, like if we extract effect sizes, and I think there is now reasonable hope that the last generation of large language models can do at least some of this. And I think these evaluations need to be ongoing, and I think it's not too far off, but there are now, you know, this is now a thing that has started. So with the international collaboration for the automation of systematic reviews, they are now doing this, we are doing this, others are doing this, and I think it never finishes. But I think what we need to do from there, I think, is to get it into guidelines and systematic review, guidelines, so that we can define a gold standard of how to do this well, whilst not doing everything by humans and often to humans, right?
So I pick from what you just said, and I also hear that, you know, say there is enough evidence. I mean, you've talked a lot about, like, we have the evidence. So let's say if we change this way of thinking, like, how will we then persuade decision makers to fund, like, collection of data where we still have and where we don't have? Has there been any discussion at your side, or are you aware of that you can share with us? Like, if we have the evidence, but we also say the evidence is lacking in other settings, how could we create that persuasion amongst decision makers? We know it's much in the air, but what's your side of work on that?
I mean, I think we need to talk evidence synthesis in general. I think for funders, it's very useful. For decision makers, it's very useful to know where the evidence is. And I would say in many cases, this is not the case. Like, I think health and some other social science niches are still the exception. But I think we are wasting a lot of resources by duplicating our work, by doing stuff where, you know, by trying to do things where we, you know, synthetic research where there is not enough evidence. And I think that's completely unnecessary by now. So I think we need to really think about how we bring this into decision making. And again, I want to talk about the Global Alliance for Living Evidence. What I really like with them is that this is because it fundamentally challenges this paradigm, right? So in principle, it never stops, right? So how would we fund this, you know? How would we define authorships? When would we update a review? And so there are many, many interesting questions, but I think what they are trying to work out, or what they are convinced of, is that this is a transdisciplinary exercise. Also responding already to some of the questions that are up there. This needs open data. This needs basically a common language. We need to find that common language across the stakeholders, because we can't do living evidence everywhere. So it needs to be driven by policy, right? So we need to have a transdisciplinary process ingrained into this, and I think that's from my perspective, it's a complicated but if we resolve it, a very promising and I think rewarding kind of place to be in the future.
So as you said, you're answering some of the questions, but I'll take a little break before you continue with that, because there is something in the questions that also goes like, what example of data gathering from out of the healthcare providers exists to create updatable models? And do you have a a nomenclature exists? I think, Rachel, do you think you have worked around where you can guide us a bit on that? Like, if there is any example of data gathering from healthcare providers? Is there?
Well, I can give you the example of in the Harmonise project, we're gathering data from different surveillance systems, particularly disease surveillance systems, and trying to find ways to integrate it with socioeconomic indicators, with land use data, with climate data. And every surveillance system has its own peculiarities, and the way that data standardization is really an issue before you can even get to harmonization, because surveillance systems, it depends on the disease or the health outcome, it depends on the country or sometimes within country. So there's an important step to ensure that the sort of definitions of all the different aspects of a particular disease outcome that you're collecting is aligned. So you can at least conduct cross-country comparisons, for example. Often there's different definitions even of age groups, like young age group, or so there's many different sort of aspects that have to be aligned before you can start making comparisons between different regions.
We were answering one of the questions from the Slido, but before we move on with more questions, I do want to thank all four of you for some of the insights and the way you answered my questions. And I think we've heard with, moving from global products to attributable research, and also how we have Europe's eye on Earth. And we need rigorous evaluations. So with that, I would like, to ask a very specific question to Julie, which we can see. Is the Copernicus Health Hub available for low and middle income countries in the global south?
So yes, the advantage of the Copernicus program is everything is free and accessible for everybody. This program is really, the purpose is to give Earth observation to everybody to better understand how is our planet going. And I think it kind of help also to advance in the project of One Health. We all heard about that. And I think it can be a good contribution for better understand how the One Health point of view can evolve.
Which means it's available, it's there. If people want to check, they can go.
Yeah, so all the data are there from Copernicus. So we have different type. So you were talking before about like flooding or extreme events. We have the emergency service data. We have data on climate change as per se, but we also have data on every part of Earth observation. And I will also I will quote something that when we met with Rachel for the first time, she told me something like, "Why do you have 6 different temperatures?" Because that is a big issue we are facing. We have a lot of data for environmentalists or climatologists that for us have makes sense, but not always for the health community. And it's also that is something is important to understand, and we try to do that with the Health Hub to make the relevant data for the health community, to avoid you to face like why I mean all this data. But yes, if you want to download them and use them, please be free to do so.
Thank you, Julie. I think that brings us to the next question, and I'll make it open who wants to take it. For example, how is the interpretation of data and development of recommendations done? Just availability of evidence will not move the right action necessarily. Would you like to take that, Matthew?
I mean, a lot of this is all around politics, and also who's holding the microphone. Oh, you want a more serious answer? So I think...
Of course. Were you thinking it was the other way around then?
Yeah, I mean, I think you know a lot of this, like it's also how it's also how evidence is framed and what platform you get to it gets presented at, and who the kind of weight that is given to this. And so, unfortunately, science and fairness were not always best friends, and things do depend on other things, you know. And you know, I'm from the global south, and I'm sure you know how the sentence is going to end. Often we don't have as much of a voice as other countries might. So it's in the hand of the, and that's our responsibility, is to bring science to bear and try and remove some of the, you know, other problems. And sorry, last point, we ultimately remain activists, I think, in this field. We're scientists, but we also, where our role is to use our truth to advance a greater cause, yeah.
I think that's a very interesting note. Yeah, sure.
Yusuf
first.
A little bit. I mean, just to, I think it was always helpful how this is phrased in the IPCC, because it's all about the role of science and policy, right? And I would say you can think like the main slogan in the IPCC is always policy relevant, but not being policy prescriptive. And I think what's behind there is something where you could say, okay, the role of science is to draw landscapes of knowledge. It's like a map. So we are map makers, I would say. But I think it cannot change that, you know, we are not this, you know, we are not steering the boat, or so I think that needs to be left to others, because it involves like deep value judgments, and I think there is no reason why scientists should be the people who are making these value judgments for society. And I think that's, from my perspective, where we should stay. And I think also in this whole kind of right-wing populism thing, I think staying a little bit modest and sticking to our to our job, I think, is a good one there.
Thank you, Jan. I think you have a response here.
Just a quick question. I mean, as scientists, we're not neutral observers. We never claim to be, and I think we're not. And we have a responsibility to also push back against people who are not observers, and also not neutral. Those who bring in, like, without science and also without common sense. So we need to kind of, you know, I think we're not neutral, and I hope not. You know, a lot of us aren't, certainly. Or dispassionate, rather. We're not dispassionate, yeah.
I think this could be a bit, maybe a provocative question, or maybe everyone wakes up after lunch. You know, we've done a lot of like stand up or stand down. So as scientists, let's say we gather, do we recognize ourselves a bit of being activists as well? So if we do recognize, let's raise our hands. And if we don't, then maybe we do not raise our hands. So as scientists, do you think you are activists as well? Yeah, so I think that kind of is something very interesting, because somewhere, you know, the science won't speak for itself till we make it speak. So I think that's something which we have to kind of remember when we are moving with some of these things. So we have another question, which would again be to any of the panelists. Maybe, you know, you can bring your own. So can you talk a bit about some of the challenges in properly working with and integrating climate data in your research? Probably each one of you who wants to you know, touch a bit upon that would be nice, as winding up our work as well. So some of the challenges in properly working with and integrating climate data into your research. Rachel, do you want to go first?
I can never go. Yeah, so I think a lot of the challenges are related to aligning the spatio-temporal scales at which you need to address the health problems. So it depends on the decision-making process. If decisions need to be made, you know, within a short time frame of a couple of days, or if it's more of a seasonal time scale, or if we're looking at sort of policy decisions which may be impacted by changes over, you know, a matter of decades. So there's many challenges of aligning the climatic information, which is often processed at a sort of, or provided at, say, hourly gridded level, but that needs to be translated to a decision-making unit, which may be some sort of administrative, like district or municipality, and it needs to be aggregated in such a way that it can be meaningful and validated. So if we want to make you know, a short-term prediction. Maybe we can rely on models that are used to produce weather forecasts, whereas if we need to make some kind of projection into the future, then we need to be looking at other kinds of models, making some decisions about different scenarios, and we need to aggregate at different space-time scales. So I think there's lots of challenges about, you know, translating these raw climatic data sets into some meaningful indicators at sort of appropriate space-time scales.
Do you? From that particular question, you know, we've already thought, will there ever be any indicator that will go across settings and that we can think that it's available? Probably there are things, but I think in the background there are certain questions that keep popping up, like will there be something that we can measure across the settings? But I think moving on from the way we've discussed, I have a question which I will like us to maybe ponder upon, and not necessarily we have the right answer. We've seen a lot of the research going on today, and you know, we've seen your work where we're talking about. And when we think about vulnerabilities, which is also a part of the Lancet thing, is there something that you would like to pick up as a priority if we need to put focus on? So I would like to have maybe a quick brief response from, so where would you like your priority on if you are given a choice with the kind of work that you are doing? So we'll take one quick priority from each one of you, and then I think we are running with the time. So Jan, you go first.
Evaluation evidence on climate change mitigation and adaptation and health.
I think closing the implementation gap by facilitating co-creation spaces between policy research and funders and the local community, which is really important.
So I'm not going to say what everyone is expecting. So for me, it would be that the health sector recognizes that we have a responsibility to control a hazardous substances that is harming health. Excessive carbon dioxide is a health risk. So we've controlled asbestos, ozone, formula milk, air pollutants. You know, we're controlling other substances that are harmful to health, but somehow the health sector feels that excess carbon emissions, not from the health sector, I'm talking about from coal, from everywhere. Somehow those is not a health problem that we need to get involved in controlling using our public health tools, as we have with other hazardous substances. For me, it's bizarre that so people that we haven't moved to that step yet. Does that make any sense?
Sure.
Okay.
So as long as we have the audience with us smiling, I'm sure it makes sense. So yes, Julie, what's your priority then?
I would say my priority is to kind of stop to work everyone in our own side. So we have the health community who pick up on the climate community, or the climate community who try to give information to the health community. And I would like to have a hand in hand and working together and really make it happening together. Yeah, that would be a nice thing to do.
Thank you very much to all four of you, Rachel, Jan, and Julie, and Matthew. I think we had very interesting things, which is probably the newer side of how the climate research is going with the new tools, the new products, some of the frustrations that we think have in the scientific evidence. We have a lot of literature. Probably we do not necessarily have the right answers to it. But I think we need to sit down and also think about how much are we ready for the uptake of these new tools. So when we are creating those two, and we heard in one of our panels, are we asking the right questions? Are we educated to learn about these new tools that are coming up? Are we teaching the right things? So I think with this last, maybe the parallel, we need to think with these newer technologies we are creating, where we already do not necessarily have to create a surveillance system. How is this going to be, the new tools being uptaken, right? So with that, I would also say that maybe we have some funders in the room, and we heard from many, that they are ready to fund the newer teams with multidisciplinary way of thinking, which would be, I think, the best way to move forward if you want to incentivize this multidisciplinary research. I hope you all agree with me on that. And if we want to incentivize that, then I think we need to also look at the complementarity of the work that's going on I like it when, Matthew, you said to Jan, we speak the same language. Probably you didn't know that earlier, that you were actually speaking the same language, right? So we found new friends here. And with that also, I think we all agreed that as scientists, we are activists as well. So I think I would like to make a personal note to all of us that we have our scientific agendas. Probably that should collide with our position agendas, when we position ourselves, like my positionality statement, and also our personal agendas too. We've heard so much that it's on me, with me. How do I want to take the climate research and try to create and reach maybe those who are in need, and also create something that we can collectively take responsibility for and know that there are concerns that we need to address together. So I think that's something we can all be mindful of that. And yeah, looking for solutions, we've heard from all of you, there are challenges. And I think with that note, I can say it was amazing to interact with all of you, and we are almost closing the parallel spaces. And I would say thank you to each one of you for having been here. And I hope we can keep this passion, and we can also keep this driving force that we see with this momentum coming up with us. And also, as I started, 15 years later, you see we are reaching somewhere. So maybe our next generation should not be asking the questions we are. They should have some kind of solutions we are creating for them. So I think that's the plea I would like with my panel. Thanks to everyone, and thanks to each one of you for being present here. Thanks so much. Thank you.